So you've been part of this family over 10 years.
Yes.
Seen a lot of different things.
Yes, it's been quite a journey for me, so.
It must be really interesting to spend part of your career doing a job like taking care of kids, and then another part of your career taking care of everybody.
It's fun. It's definitely been very life-altering for me. Working night shift in PI for about 5 to 6 years, and then going to day shift after that, and then now transferring to being a practitioner, taking care of everybody.
Right.
It's kind of a full circle. So.
How does it feel that you spend most of your wake time here with us?
Well, I did spend most of my sleep time here too.
Good point.
Before, so it's been great. I mean, it's like a second family. I was born at AGH, so I've been like a Shands baby ever since.
When you think about what you and your colleagues do around here, what do you think is the lasting impression we leave with our patients and families?
I think that we care. Like, we're not just a hospital. We kind of go beyond measures. Like, we go further than I think a private hospital or other agencies near us. So.
Not only were you a Shands baby here, you and your family have had other healthcare experiences here.
Yes.
What's it like on the other side?
Thankfully for us, we had a great experience. My son we found out we were pregnant, and then during the pregnancy, we had to go to a specialty clinic, which thankfully we have here at Shands. I felt in the greatest of care. I actually, because of my experience in the PI, I knew all of my physicians. They took very good care of me. It was amazing to see them. Not only had I seen them on the caring side of like the professional side, but I got to experience their actual care as a patient. The time that they spent with me and my family was very, very heartfelt. I remember we had he's now an attending, he was a fellow at the time that I worked with him in the PI. He saw my name up on the board, and he goes, "Is everything okay? I saw your name." And came in, just spoke with me and said, "Everything's going to be okay." And it was awesome to see. But afterwards,
really cared about you.
Yeah,
That's awesome.
Yeah. But afterwards, we found out that we were going to have to go to the NICU, and so the NICU team was amazing. Also, the facility down there, we were there right when it first opened, so we got to see the brand new NICU, and it was nice to see some of the people I'd worked with too. So. My baby was a 9-pound, 3-ounce baby in a NICU, open crib, so he was a giant child compared to all the others. But it was nice to have that experience, and then come to find out he was going to need a surgical repair, an ASD and a VSD repair, which is 2 holes in the heart. And that was performed by Dr. Blywise. And I'd met Dr. Blywise several times. He's quite funny to see after surgery because he doesn't leave his patients.
Right.
I've seen him camped out in a bedside chair, having orders come out, just sipping his Gatorade and taking his time. And it was nice to see him kind of talk with me and my husband about it. My husband is not a medical person, but he was able to genuinely sit down. We discussed the treatment plan, and we were taken very good care of, and then we had our stay on 10-2, so
right.
It was amazing. And I knew the nurse by previous instances from PI, because before we had split. Right. And she was fantastic. I had my cardiologist texting me updates in the OR. I had the anesthesiologist who is an attending on PI. He was giving us updates. I mean, I couldn't have asked for a better team or better support, so.
So when you think about all that, would it surprise you if I told you that that whole team has the #1 outcome in congenital heart surgery in the entire United States?
I am not surprised by that.
Right. They care, and they do great things.
They do. They are definitely diligent and put 110% into everything they do.
And when you go to work, you have obviously colleagues you work with, and in your time in the PI, you got pretty close to a lot of people.
Yes.
What kind of pride and enjoyment do you get out of your colleagues?
The people that I worked with in PI, they're like life members of my family now. I have people where we've celebrated births, we celebrated anniversaries, we've mourned deaths, not only of patients, but also family members. So it's been really great for like me, you know, growing through this whole organization. But it's been a lifetime, and I think anybody who is lucky enough to know some of the people I've been blessed to meet, they are very, very fortunate, especially the way that they take care of their patients.
It's a pretty lasting legacy to be thinking about.
Yeah.
And so in that context, what do you want to leave behind in 40, 50, 60 years when you decide to retire?
I'd like to just be known for caring and providing great treatment for anybody who asked me or needed something, that I kind of did that extra step. That's what I want to be known for, you know.
Thanks for making a difference. You're a big part of this family, and there are 11,000 of you and I doing our little part. So thanks for everything you do. Appreciate you being here.
Thank you. Thank you for doing everything for us.